others that...
This meeting is being recorded.
Great. Give new people a chance to say something and speak. And depending on how many people we have, ideally, we want to give everybody a chance. We call that open discussion. I have a few announcements to make at the outset. Once all that's out of the way, then we can turn it over to you. And time remaining will probably be at least 30 to 45 minutes. And then there may be questions. So, and you call your presentation interactive. So I think you want to give people a chance to ask you some questions. So we can go a few minutes over. I mean, I have unlimited. I think this is an unlimited Zoom, but we try not to go much over an hour. So.
Do you serve dinner with your session? Dinner?
Say again?
Do you serve dinner, food?
No Italian tonight. I don't know about Japanese, possibly, until
Sure.
what the cuisine is. I noticed they settled the railroad strike, and it said last night they ordered in Italian. And I was thinking to myself, I wonder if that's really the best food to order in. It's great, it's terrific, but something more gentle maybe, because they were going to negotiate through the night. But apparently they settled the strike. My wife and I are supposed to take a train to Philadelphia on Saturday to go to a wedding. So hopefully that will not be affected.
Hi, Howard. I just thought I would check. I'm on. They're chatting away. Oops, wait a second.
Okay, so yeah, it's just about 7. We're going to start, well, it's 6:54. We'll start at 7, so we'll give people a chance to come on.
Right.
So your brother wants to participate. He's welcome to do so. Howard, right? Your brother Howard. He can call and he can dial in. Does he have the number to dial in?
She's on the phone with him.
He's on the phone now. Was that his image there for a second? Oh, Glenn. This is Glenn Robotsky. Is this Glenn Robotsky?
That's Glenn.
I recognize you, Glenn.
Hey.
Okay, how you doing?
I'm good.
Thanks for joining us. We're going to start in a few minutes at 7.
Glenn?
You're in Queens, is that right? In New York?
I am in Queens. And I don't know if this is part of your agenda, Steve, but I figured I'd just ask offhand, any news on recruitment going on at the foundation, or have you not heard anything?
I haven't heard anything to replace Nancy Froman.
Yes.
Yeah.
I haven't heard. Have you, Pat, heard anything?
No, nothing.
No, I haven't heard anything either.
Yeah. I was hoping you had, Glenn.
They're a little afraid of me over there, Pat. It's not always easy to get the office to talk. I may actually talk to some of the people on the board, but they may not want to reveal anything as of yet.
Yeah.
I heard through Nancy that they're looking for like an ideal person would be someone with social media experience, because Nancy had some of that, but not a lot. So they really want to get to tap into that.
And certainly he had that experience with Greg, and just the tremendous outreach. People worked hard to get it covered.
Right.
So I hope they keep that momentum.
Yeah, he's back now in the DC area from his trip. Did he?
Yeah.
He didn't bike back, right? He flew back.
Oh, no, he flew back.
Right.
In fact, I thought when he said about the bike weighing 200 pounds itself, what it costs to fly it back.
Yeah, it's probably thousands of dollars to fly back. Right. Okay. Well, anyhow, we'll start at a couple of minutes to 7. We'll start on the dot at 7. I don't know what that background noise is. Someone doing something with their microphone or something. You hear that background noise? I don't know what that is. I don't know.
If anyone wants to rename, if they want to put your name so that people can read it, if you're comfortable with that, you can click on next to the blue ellipses and say rename, and you can put up your full name or just your first name. It helps to call on people.
Great.
Steve.
Yes.
I clicked the record button because Bill was going to speak, and I wanted to just capture that.
Sure.
Is that okay?
With Bill recording it? Bill, is that okay with you? Yeah, okay. I think that'll be okay. Sure.
But I wondered if it was okay with you.
No, it's fine with me. I mean,
okay.
Basically, why don't we get started? It's a couple minutes to 7. And yeah, I'm pleased to be recorded about the whole thing. That's great.
Okay.
So let me welcome everybody. My name is Steve.Klitzman. For those of you who are new to this group, I started this group in November of 2021 with the great assistance of Pat and Judson from the Virginia group, and also Eleni Anselatos, who helps administer the group from Suburban Hospital. It's really been good. 10 years, before that, for 10 years from 2010 through 2020, I led the Virginia group. And my wife and I lived in Bethesda, and then we downsized, moved to an apartment in Chevy Chase. And so I kept thinking, well, can't we get a group going in Montgomery County, which has not had one, which is amazing. So we started this one, and it's really been good. And you all should have received from Eleni a notice. They do a pretty good job of sending it out. It gave tonight's agenda. And she also, I asked her to include our mission statement. We have a one-page mission statement. And the bottom line of that is you're not alone. If you have this condition, you should know that the support group is with you all the way. And you're not, struggling with this by yourself. So what we want to do tonight, we want to keep it to an hour, is I'll make a couple of announcements, and then I'm going to introduce who I think are some of the new people. I'm glad to see David Feit is on the list. He actually lives in my apartment building, and we went to an ice cream social a few days ago, last weekend, and he started telling me he's just been diagnosed with PN. And I said, oh, really? So we've been talking, so I'm glad that he is with us tonight. And we'll introduce them, say a few words. Depending on how many people we have, looks like we're up to, it says 15 in the group. So if it doesn't get much bigger than that, we could have open discussion from everyone just for a couple of minutes. And then I want to present Bill Porter, who's not only a patient of some years that I met in the Virginia group, but he's become a facilitator. He's helped lead groups like the Virginia group. He lives in Richmond, Virginia. And he has what he calls the 16 A's interactive presentation, how to cope better with neuropathy. And I think especially with new people, I think you'd find this very beneficial to listen to him. So let me make a couple of announcements. One announcement is Dr. Brett McCrae is an assistant professor of neurology at Johns Hopkins. And he is our medical advisor. We have an informal medical advisor to the group. So if any medical question comes up, we can email it to him and get you a response. He was supposed to be here tonight, September 15th. We booked him last June when we stopped meeting over the summer. But maybe in late August, early September, he emailed me that he couldn't make it tonight. He wants to come in October. So he'll be here on October 20th. And just keep in mind, our meeting is the third Thursday of every month at 7 by Zoom, third Thursday. So October 20th and then November. And sometimes December, we might have a holiday party or whatever. I don't know if we'll do that live. Eventually, maybe we'll be able to meet as a group live and have a party. The only months that we're probably not going to meet are in the summer, July and August. So with that, let me just go down the screen. Let me start with, in the order you appeared. Lawrence, you want to, can you unmute and tell us a little bit about yourself? Larry Feinberg. Larry Steinberg. Larry? There you go. Go ahead.
Yes, it's Silverberg.
Silverberg. Sorry about that.
Oh, that's okay. I've been called a lot worse. Trust me.
Okay.
But anyways, so I have a neuropathy for, I'd say, since 2003, and I probably had it before. And I really have it very widespread. It's everywhere. It's through most of my body. I've been,
Can you put a little bit more light on yourself? I mean, you can't see you.
What is that?
Can you put a little bit more light on him? I mean, in his room, it's very dark.
But you're having trouble seeing him?
Yeah, but it's very dark. It's very dark. I mean, everybody.
Well, if you can't see me, consider yourself lucky.
Okay.
Well,
right.
I see you there.
I can see you there.
Okay.
I think we want to hear him as much as see him, but I can see him. So go ahead, Larry. Go ahead.
All right. Sorry.
I am lying down because my feet are totally numb, and I've been sitting, and I can only sit for a certain amount of time because I have the polyneuropathy, and I also have radiculopathy. I fell and fractured my spine, so I've got kind of the double whammy. I probably have the polyneuropathy from being on interferon for over close to 30 years I was on interferon injections. So that's pretty much my story. I mean, I'm
at an angle.
What is the
trying to get it
interferon
straight.
for? Is that for cancer, or what is interferon?
It's for my bone marrow cancer. I have polycythemia vera, which is a myeloproliferative disorder, and it is a bone marrow cancer. Fortunately, it's a very slow-growing cancer, and I've really done very well with it. But you know, I'm sort of coming to the combination of everything, from my spinal back. I played football in college, and I had, you know, terrible spinal problems. But the worst thing is the polyneuropathy, which is really spread all over my whole body. My fingers are numb. I have trouble picking things up. But I tell you, I'm taking gabapentin, and it's no magic, but it's just taken the edge off of things. And fortunately, I have a wonderful wife, married for over 40 years. And without her help, I couldn't do it. So pretty much in a nutshell, that's my story.
Okay, that's very good. Let's see. I see a new person. Bert, are you new? Bert Simpson?
Yes, I am Bert Simpson.
Yeah, tell us about yourself. Go ahead.
Well, I discovered about a year ago, I discovered some numbness in my calves, and particularly in the left calf. No pain, just numbness. And only when I'm walking, when I'm sitting still like I'm sitting now, I don't have any symptoms. And I went to a neurologist who sent me to a vascular surgeon to see what the circulation is like in my legs. And I discovered that, and then she sent me also to for an MRI. I discovered that I have stenosis, she said, in the lower part of the spine, and that some of my arteries were blocked in my leg. And so the neurologist said, you can't do anything for me. The vascular surgeon put me on an exercise regimen in order to try to improve my circulation in my legs. And we estimate now that I have some collateral blood vessels around the blocked arteries. So I don't seem to have any really bad side effects from this. The thing that I'm uncomfortable with is that I have difficulty walking after a while, and I'm somewhat unsteady, so I started walking with a walking stick to keep myself upright.
Good.
I basically hope that it doesn't get any worse. That's
Good.
it.
Well, it's very interesting you say they found some stenosis, because my latest visit with my neurologist some months ago, I had spinal stenosis for a while. I had some epidural shots in the lower back about 7 years ago, and they've worked very well since then. I've had no pain. He thinks a lot of my difficulty in walking and the weakness I feel in the legs is more from the stenosis than the neuropathy. The neuropathy is there, but I always thought, oh, it's neuropathy. So I went to two neurosurgeons, and basically what they told me, and you can consider this for yourselves, if it ain't broke, don't fix it. If you don't feel radiating pain going down your legs, forget about it. You're going to have stenosis. It's extremely common. If it's not causing you any pain, don't operate. This is from GW and Georgetown. So if surgeons tell you not to operate, don't operate. Don't mess with your back unless you're feeling the radiating pain. And I know Pat, I think, in our group had some surgery. It's made a big difference for her. Everybody's different, but that's my situation. Okay, so let's
let me just understand
Go
what
ahead.
you're saying. The neurologist that I went to, and I just went to one, and only once or twice, said that the neuropathy, the peripheral neuropathy, is caused by the stenosis.
Is caused by the stenosis?
Yes.
What's the name of your neurologist?
Dr. Wang.
Wang?
Yeah.
Where was he in the DC area?
And he's on 7 Locks Road.
Oh, in Bethesda?
In Bethesda, yeah.
Well, I've asked that question over the years, and I've been told by other neurologists that it's two separate conditions.
Really?
There are overlapping symptoms,
Right.
but to say that the stenosis caused the neuropathy, I've never quite heard that. But if that's consistent to some extent with what my doctor said, is that it's the stenosis that's really caused the weakening, not the neuropathy. So anyway, whatever the cause is, we got to live with it. But again, the rule that I've been following is if I don't feel the pain, I'm not going to mess with it. And you know, I wasn't sure.
May I just add one other thing?
Go ahead.
If
Okay.
I may.
Sure.
I went just on a whim. I went to a well-known physical therapist in Bethesda, and he prescribed some exercises to do at home for the back.
Right.
What he told me to do is in the morning to lift my knees and press them to my chest multiple times, 20 times, he said. And the other exercise is in an attempt to relieve the pressure on the spine from the stenosis, from the pressure on the nerves.
Right.
And then also when I get up, I bend down and while I'm seated, and touch my hands to the ground and as far back toward the back as I can, and I stretch that out too. Somehow that relieved all my muscle pains in my back. You know, maybe it'll relieve some of this. But anyway,
well, that's very good. That's very good.
Yeah,
yeah. So those are the kind of tips that we can share with each other, and I just wrote them down for myself. So yeah, that's very good. Do you have any? He didn't give you any like handouts or illustrations or something?
No, not yet. I've only seen him once or twice.
Okay, well, if you see him, what's the name of the physical therapist?
His name is Al Brodnick.
Alan what?
Alan Brodnick, Bronick.
The last name spell again?
Brodnick,
Bronnick.
Nick, Brodnick, Al Brodnick.
Where's his office?
Bethesda Physical Therapy. It's on Bethesda Physical Therapy. It's in that complex where all the doctors are
right, they're everywhere. Right.
Of Democracy Boulevard, in that area.
Somewhere, I don't know if it was through Glenn Robotsky's group or the Western group or somewhere, I saw a presentation by physical therapists who specialize in neuropathy.
Yeah.
And when I saw that, I should have jotted it down. Maybe we can find out, because I would think by now there are physical therapists who really understand neuropathy and can give you very specific exercises. The PT people I've gone to so far, frankly, hardly knew anything about it. And they gave me things that really weren't that relevant. Didn't make much of a difference. But it sounds like this guy might be in that.
I just started that, and the clinic is very busy, and they had to, they have to look for cancellations. So I've only been able to see him and one of his assistants. And,
okay. Very good.
We'll see.
Okay. Thank you very much. Thank you, Bert, for sharing all of that. So let me turn to Cynthia Colton-Reichler. Cynthia, do you want to unmute yourself? Unmute. There you go, Cynthia. Hi.
There you go.
Is this
Hi.
your first meeting, or have you been here before? You look vaguely familiar, but I'm not sure.
Yeah, I think I attended one other meeting that you guys had. Right. Yeah.
So tell us about yourself. Go ahead.
Well, I'm out of Connecticut.
Oh, you're in Connecticut. Okay.
I'm Connecticut, and I've actually talked to Pat.
Oh, I've been in touch with you. Yeah, you were thinking of starting a group in Hartford, right?
Exactly.
Right.
Exactly.
So you spoke to Pat, right? Exactly.
So, so my story is that back in 2018, I had a gallbladder surgery, and the gallbladder surgery actually caused my neuropathy. It's small fiber, it's poly, and my primary symptom is pain, which is widespread. I have some numbness, but the primary symptom is pain. And as you mentioned, I'm interested in starting a group in Hartford, and I've been in touch with my pain doctor, who has some interest in what I'm doing, as well as my naturopath, who I haven't seen in a while, but he's been very helpful when it comes to treating me for neuropathy. And
great. But I was telling Pat the other day, I had a call from a gentleman who just moved from Maine to Connecticut, and I don't see his name on the list so far, but I can get that to you. Well, if you want to give me your email, I'll look you up because I have emailed you before. I'll send you his information. But I was telling him about you, that you were someone who was going to start a group in Hartford, and we hadn't heard back. If I'm not mistaken, is there no group at all in the whole state of Connecticut right now, or there's one group?
Last I knew, there were 2 down in Fairfield County. If you're familiar with the Connecticut coastline. Yeah,
right. Okay.
There were 2 out there, but last time I tried to reach out to them, they didn't respond.
Okay.
So
we'll definitely follow up with you. So that's very good. Thank you. I'm glad you're here.
Cynthia.
Yes.
Cynthia, at one point you said that you had someone who might be willing to co-host or co-moderate the group, but that she was suffering additional health issues. Has that resolved, or are you pretty much on your own?
At this point, I'm pretty much on my own, Pat. I've reached out to her twice by phone, check in to see how she's doing, and I haven't gotten a response. So
okay, great.
Well, we want to support you. I know Pat and Judson do through their network. And, you know, sometimes you might want to consider starting it and see who shows up. And then if somebody really impresses you, you know, reach out to them, because, you know, you can start very small, and even if it's only 6, 7 people, and then you can build on that. And the word will get out that Hartford has a group now, you know, you're the capital in the center of the state. So that would be important. So that's great. Okay, let me turn to David Feit. David is my neighbor. We're in a movie group together here in the building. Once a month, we review and discuss movies that we stream. And so he was telling me the other day that he's recently been diagnosed. So David, go ahead.
Yeah, as I was saying, I talked with Steve at this ice cream social, and we started talking about polyneuropathy. And I've been having balance issues for about 1.5 years or so. And my doctor sent me to a neurologist, and they did an EMG test and muscle test, and a mild sensory motor polyneuropathy. That was my diagnosis. And that's my story.
You're not in a lot of pain, right? What are your symptoms? You have numbness?
I just have trouble walking straight, and my gait is abnormal, they say, and balance issues.
Right. Well, that's very important. So if you are you using any, I don't recall you being with any device. Are you using any device now to help with the balance? No. Not yet. Okay. Well, eventually you might want to start with a cane or possibly a walker. You know, I'm using a rollator, but you know, make sure that you feel contact to the ground. But you're early on. And one thing I brought to Dave's attention, any of you who are new, if you go to the Foundation for Peripheral Neuropathy's website, ffpn.org, I think it is, and you look in the homepage upper right corner, they have something now called Newly Diagnosed. Click on that, and that gives you a good start to all kinds of things to start looking into. They have some excellent webinars and recordings and other things on the Foundation's website. And also we have a very good website through the Virginia group that Pat and Judson administer. And we send out with the notice the link to that, so you can get their material as well. Right. Well, David, I'm glad you're here. Thank you for coming tonight.
Okay.
Let's see, Bill, I recognize, well, I'm not sure I do recognize him. Bill, are you new to tonight, or you've been here before? Bill, unmute.
I've been here since day one.
Are you Bill Hurley?
Bill Hurley.
Oh, yeah. Bill Hurley is the man who got us the very good chiropractor that we had.
Dr. Mahoney.
You still stand by Dr. Maloney?
Yes.
Yeah. He made a difference in your life. He got you walking again, and he presented to us some months ago. So I want to thank him again for that. So you've been here. Let me get some new people, make sure the newbies get to speak first. Okay, hold on a minute. Charlotte, let's see. How about Charlotte? Are you new tonight? Okay, go ahead, Charlotte.
Can you hear me?
Yes, absolutely.
Okay, good, thank you. Okay, I was glad to see this because I had chemo not last summer of 21, and it ended in October, almost a year ago. And I've had neuropathy ever since, in my feet and a little bit in my hands. You know, my oncologist keeps telling me that there's nothing that can be done about it. And I mean, I'm walking. I had some complications with the some surgery, and I have a heart issue. So I ended up with a little bit of a stroke, and I wasn't sure where the stroke, if it was affecting my balance or it was the neuropathy. So I'm walking okay now. I was on I was in rehab for a little while after all of the medical things, and I was on a stroller, you know, a walker, and I'm walking pretty well. I do a lot of exercise. I go to the gym a lot, but I just wanted to know if there's anything I can do. I do take a Gabapentin. I probably could increase the dosage, but I take a lot of medication, so I want to know what I can not take. And I just I'm a Johns Hopkins person, and so I went online to see if there was anybody who specialized in this, and by Jove, I came up with Brett McCrae.
Yes.
And I have an appointment with him on Monday in Baltimore.
Great.
We'll give him our regards. Tell him we missed him tonight, but he'll be with us in October. So.
I see that, but I had no reference to him. I just did a search and found out what he was doing. And so I'm looking forward to not only meeting him, but also here. I didn't know that he was the advisor to this group. He's a young man, right. Primarily in research. And I appreciate it. They scheduled me right away for an EMG, but he wants to see me before they do that because he might not recommend that. So I'll start the workup with him on Monday at my 7:30 a.m. appointment.
Oh, wow. If you can get up for that, you're not in bad shape. So that's
I'm going to stay overnight in Baltimore.
Yeah, so. He's very big also on hereditary issues. He's done a lot of research.
I know that he does very serious things, and maybe mine's not serious enough because it is a chemo related. But
right.
Charlotte, the other thing to know is that even if you are not certain of your results, it's idiopathic, you're contributing to the National Registry when you go to Hopkins. So you're helping future patients, even if you don't get immediate relief. It's an important part of the Hopkins program. So,
oh, that's great. Well, it just seems ridiculous that there's not some way to treat this. And I guess he's doing the research. Now I don't have pain. It's like both feet are asleep all the time. Yeah. And a little bit in my hands. I'm finding it hard to type. But you know, I mean, I'm 75, so I mean, there's some age-related things here too. So you know, I really am delighted to find this group and to know that Dr. McCrae is already a part of the.
Right. Charlotte, what is your email? The reason why I ask is because the foundation puts out what they call e-news. Some of you may get it. Comes out once a month, FPN e-news. And the September issue, the last item, it says CIPN, 8 frequently asked questions and answers. In this article, Memorial Sloan Kettering Cancer Center physiatrist Jesuel Patro-Guzman answers 8 common questions about peripheral neuropathy induced by chemotherapy, also known as CIPN. It says, as a rehabilitation medicine doctor, Dr. Patro-Guzman cares for many patients with CIPN. So I definitely would recommend you check out that article, and you've probably done your research already, but this might give you some thoughts or questions to raise with Dr. McCrae on Monday.
Oh, that's great. I will, Steve, yeah. I'll send you my email address.
Yeah, send me your email, Steve.klitzman
I will do that.
at gmail.com, and I'll make sure you get that.
You know, my cancer workup is normal. Everything is normal. I'm doing very well in many ways, except for this neuropathy.
Okay.
Charlotte, I put the foundation's website in the chat room, and you can simply go to the website and find the article that he's referring to.
And one thing you can ask McCrae, I don't know if he'll tell you, is they're doing research at Hopkins, especially Ahmet Hoke, H-O-K-E, who's Brett's boss. He was doing research on the chemicals some of the chemicals that are used in chemotherapy, and some of them are more toxic than others, and they've known this for years.
Right.
And I've never quite understood why they just can't phase them out and have used less toxic chemicals. And he's been studying that, I think. I mean, that may be a gross overstatement of what they were doing, but you might want to ask him, is there any study or progress going on chemicals? And maybe in your case, you've had it, so just academic.
I did have it. Taxol is the drug that causes
it, and then they're still using that. Why?
They use it on me less than a year ago.
Yeah. So why are they using it if it's known to induce it? The attitude maybe is, my internist told me once, what would you prefer to have, a stroke, heart attack, or neuropathy? When I told him I thought Lipitor caused my neuropathy, and he said, well, you know, it's a choice you make. And so their attitude is, you know, you'll get chemo. I mean, you had cancer, so whoever kills the cancer, we're going to use, no matter how toxic it is. And that thinking is not, frankly, is that helpful to patients?
But you mean it's after the fact. What can we say except that they should, you know, for future diagnosis? For me, it's, you know, I've already had it, so we'll see.
Well, I'm also working on comparable medications that are administered at the same time that are supposedly going to offset the extreme negative reaction caused by the chemo. So if they can get that to work together, it might allow them to do both.
I'll ask him these questions. I mean, we don't have a long appointment, and I'm sure if he's going to be here in October, he'll be happy to tell the group.
Okay. Well, good.
Make
sure you send me your email, Charlotte, and I'll send you that thing from the association. Thank you.
Thank you.
Carol McLeod, I don't know if I asked her to unmute, but she's not. The name's familiar, so she may have been here before. Lawrence, we've spoken to. Mark, have we asked Mark? Mark's name may be new.
Steve, Carol just unmuted.
Say again?
Carol.
Carol. Yeah, I think I recognize you. Carol, you've been at the prior meetings, haven't you?
I have been, Steve, and thank you, everybody. Nice to be here. I don't come very often. I've checked in a few times, but I'm in the class of sort of idiopathic neuropathy for many years, and sort of undiagnosed. So I would tune in and hear everyone sharing and realize, yes, I identify with this and this and this. So
where do you live? Do you live in Bethesda, Chevy Chase?
Bethesda.
Okay.
Lived here for many, many years. And I also am very active in suburban PAT as a volunteer. And so my neuropathy, I just recently had a lot more intervention on it than I have over 10 years. I probably had increasing neuropathy down my legs for 10 years or more. And so recently I just had a second set of nerve conduction tests and MRI from head to toe. And so I don't really have a specific diagnosis of neuropathy, except I do have L5 pressure on the L5 nerve bed and decreased conduction there. What also they showed recently with the that I have some pressure on the spine from arthritic growth. So that's the major problem. There is arthritis growing there. Pressure on two areas of the spine. So that was also now sort of an introduction into is that causing the neuropathy and how do I deal with that?
Right.
Carefully. I'm here really here listening and
sure.
Identifying.
Have you been diagnosed with spinal stenosis?
Yes, so I've been diagnosed with probably every except thorax, so a lot of problems with stenosis, every kind of arthritis in most joints.
Right. And do you get shooting pains down your legs or like sciatica?
When I had pain down my legs from what do you call it, from your L5
right,
sciatica?
The impingements, right.
Yeah, when I had sciatica and when I had a couple of the injections, the steroid, the second one really cleared the pain. So I don't have specific acute pain there.
Right.
but it did affect the conduction, in particular down the left side. But now the neuropathy it's down from both knees down the shins, the front of the feet, and it's not all the time, but you know, it's been there for so many years. But one of the major things now that's happening is when I stand very much to talk to people or just whatever I'm doing, my legs get like logs. They get very dead. They get tight. I can't stand on them.
So you have to be careful that you don't fall or trip. You got to sit down or hold on to something. Right. So are you using any assistive device now, like a rollator, or what did you say, or a cane? Or?
Actually, I just came from a physical therapy this afternoon. I'm doing very well with that. I haven't been compromised too much in walking yet, or etc.
Okay. All right. Well, that's good. So, you know, try to keep that as long as possible. But eventually, you might need some device to help to keep vertical. Stay vertical is one of our sub mottos. Stay vertical. Right. So
yeah.
Okay. So let's see. Mark, thank you again for joining us tonight, Carol. Let's see here. Mark, can you unmute? Yeah, thank you very much. Mark, I'm not sure okay, where Mark is. Let's see. So D Lime, let me see. I don't recognize D Lime. Is that a new person?
Mark, who is Pam, I just asked her to unmute.
Oh, you asked who to unmute? D Lime?
No, Pam.
Oh, who's Pam? I don't see Pam.
Who's raising her hand?
Okay. Okay, Pam, go ahead. Pam.
Hi, I'm sorry I signed in late. It's been so long since I've been with the group that I just, you know, but here I am. So what are you doing right now? Well,
so we're just going around very briefly and asking, especially new people, if you're not newly diagnosed, you can still talk to us. Have you been, I don't think you've been to one of our prior sessions here in Bethesda, Chevy Chase through Suburban Hospital. Have you, or have you?
The last one that I was at, I think, was in April, where somebody named Steve Mahoney.
Oh yeah, the chiropractor. Yeah. So you were there. Okay.
Yeah, and I just
didn't recognize your name. Yeah. Right. So what is your last name, Pam?
Brown.
Brown. Okay. So you're welcome. Tell us what's going on with you now. How are you doing now? What's happening?
Doing well. Ironically, I just had my annual physical this morning with my general practitioner, and he's aware of my overall health status, and he thinks I'm doing well. I had the very definitive test that confirmed peripheral neuropathy. I can't remember the name of the test, but anyway.
The EMG, yeah, electromagnetic resonance.
Yes, exactly, right.
Right.
Yeah, right. But I and also in one of the sessions earlier, the guest speaker said that the studies on mice had shown evidence of a benefit of exercise in terms of stopping the progression of neuropathy.
Absolutely, that seems to be a general conclusion, right?
So my doctor really confirmed that this morning. He said anything you do that keeps yourself moving and keeps blood circulating is really beneficial for neuropathy. Anything.
Right.
So,
okay.
Yeah, that's what I'm doing. I'm exercising online through Suburban 3 times a week, strength training and walking now. I'd had a knee replacement in March, which was amazing. and it worked, my first joint replacement, hopefully my last.
Right. When you say through Suburban, is that online through Suburban?
Yes,
they have exercise
online
classes?
Yes.
Right. So that's good. That's good.
But been doing it for years. So that's where I'm at. So far I'm mobile, and my goal is to stop the progression as much as I can, or delay it as long as I can.
How long have you had the neuropathy?
I'm thinking easily 10 years.
Okay. All right, good. Well, there may still be some way to do that. The longer you have it, maybe the harder it is to slow it. But if you're exercising, keep doing it. Absolutely.
Yeah.
Okay, let's see if Margaret, I'm not sure who Margaret's last name. Margaret, you want to unmute? Margaret?
Here I am.
Yeah, what is your last name?
Oh, Eubank, you know me.
Oh, Margaret Eubank. Oh, of course, I know you. Margaret is a veteran of the Virginia group. Hi. Hi, Margaret. How are you? What's going
Oh,
on?
hi there. Now I see myself. Okay.
Right.
Well, actually, what I've started doing is seated yoga. And I live at a retirement center in Ellicott City, Maryland. And I've had neuropathy for about 12 years. I also had stenosis. But I've started doing seated yoga here at this retirement center. And I find that extremely helpful.
Yeah, that's great. I don't know, in the old group in Virginia, I remember we had Tai Chi classes.
Yes.
I don't recall. I think we did share a yoga session that was beneficial. We didn't, follow up. So how often do you do chair yoga, seated yoga?
Actually, it's only once a week.
Okay.
They have Tai Chi here. I haven't tried that yet.
And that's a little trickier because there's a lot of balancing involved with Tai Chi.
And actually, I did physical therapy for 3 months this summer, and that helped a lot. And then you just have to keep it up, the exercise.
Yeah.
Right.
As much as you can.
That's great. Okay, well, I'm glad to recognize my friend Margaret. I haven't seen her in a while, so be well. Great, thank you, Bonnie. Go ahead.
Yeah, one always has to just keep at it.
Right, exactly.
It's kind of gets a little monotonous, but if you don't do it, you notice it.
Did you ever connect with any Maryland attorneys to update your papers and everything?
I'm sorry, I didn't hear that.
Did you ever connect with Maryland attorneys? Remember, I gave you some names of attorneys to help you update your state documents from Virginia.
Oh yes, that's right. I did get help with that.
Yeah, you did. Okay, good, excellent. Okay,
and,
all right. Great.
Actually, our head of physical therapy here at they have a rehab at this retirement center, and she's speaking. We're having a presentation on this Tuesday.
Okay.
Coming Tuesday. So I'm going to recommend this group and also the foundation to the people who attend this session.
Excellent. Thank you. Thank you. All right, Bonnie Fields, you want to unmute?
Sure, I did.
Go ahead. Welcome.
I'm unmuted, and I am probably on video also.
Good.
And we are new, and there's myself and my husband, Larry. And after listening to everybody speaking, I think we're in the wrong place.
Well, have you been diagnosed with peripheral neuropathy?
He has had some neurological tests and been told, yes, he has some peripheral neuropathy in his feet and lower leg. Also, the podiatrist has made note of that. And I have occasional numbness in feet, lower leg, not very severe. And all of the other things that several people have mentioned: spinal stenosis, L4-5, getting injections in my spine. I have a wonderful doctor who's done injections for me 3-4 times. And I also have 2 artificial knees, and I love them. And there you go. But other than that, I think we're in pretty good shape.
Why do you think you're in the wrong place? Because you're doing so well, or what?
Yeah, exactly. That we don't have some of the same issues that everybody else seems to have. Yet.
Well, consider yourself lucky. Exactly. Don't be too cocky. You never know what's coming down the pike. So.
Oh, I know. Eventually, yes, I know what's coming, and it's just a matter of other than exercise, which of course everybody has mentioned, as well as our physicians have mentioned. Exercise is the ticket. And lose weight, and other than all that easy stuff to do, what else is there?
Yeah, right. Well, keep on keeping on, as they say. So thank you very much.
Is this a regular?
Yeah. So we meet the 3rd Thursday of every month from 7 to 8. We're gonna get on to Bill Porter shortly. Where do you live?
We're in Rockville.
Oh, Rockville. Okay, good. Yeah, so it could be anywhere, but yeah, we'll be meeting the 3rd Thursday, and we have Dr. Brett McCrae, who was mentioned earlier. He's coming in on October 20th. That's our next meeting, 3rd Thursday of October. Very good. Welcome. So let's see.
Thank you.
Thank you very much, Peggy. Let's see, Peggy. We had Dory. I think Dory may have been here before. I'm not sure. You have been. Okay. You want to just tell us very briefly how you're doing? What's going on? Unmute. It says mute. Okay. Dory, unmute.
He isn't muted.
Oh yeah, go ahead, Dory. Go ahead, Dory. Now she's muted. Unmute.
No.
There it goes. Dory?
Dory, you have to turn on your audio.
You turn on the audio. Your
The left corner.
No, it's not on. Okay.
That's a shame.
All right. Well, let's just move on. Now, Rebecca, I think, is probably Rebecca Hotop, probably. I'm not sure. Rebecca asked to unmute. And then we never got D Lime either. Oh, Rebecca?
I'm here.
Is this Rebecca Hotop?
No, this is D Lime.
Oh, D Lime. I'm sorry. Yeah. What is your first line?
My name is Donna. My name is Donna Lime. Yeah.
You're new tonight, aren't you?
I'm totally new.
Yeah. Where are you from? Where are you from?
I'm from Bethesda.
Bethesda. Great. Tell us about yourself.
Well, all this is new. I was diagnosed with neuropathy maybe about a year ago because I've been having numbness in my feet. And it's not all the time, it's just sometimes. And various doctors have said, oh, there's nothing we can do. You know, it's not serious, just leave it alone. But I heard about what you all are doing and I've been listening. And I do have one question because a couple of doctors have suggested something called Gabapentin.
Yeah,
I've noticed that. And I'd like to know how does that help neuropathy if you have tingling of the feet? Oh, okay.
No, I mean, I can add a little bit if you want me to.
Do that question, and probably in a book, but maybe how about in a few sentences? What is it about Neurontin and Gabapentin that is always the drug of choice by neurologists? They always prescribe that, and what do you think about it?
2 or 3 things about gabapentin, which is why it's often the drug of choice. 1, it's cheap. 2, it's metabolized through the kidneys, unlike a lot of the other drugs that are out there. So people with liver problems can often use it successfully. However, you do have to have reasonably good kidney function. And the other reason is that basically you can really work with the dosage. It's something that you can ramp up fairly quickly, although of course there are some side effects for people, but it's something that you can go up and down very carefully with. It's basically an anti-epileptic drug. That's what it was originally designed to do. It upregulates inhibitory neurotransmitters on the level of the brain and spinal cord, and basically that mechanism helps to damp down some of the runaway nerve impulses that people.
Okay, very good. Well, you're approaching a paragraph. We finish up. Okay, but I knew you'd have a lot to say about it. But it's very commonly prescribed. Take it. Keep watching how you're doing, and tell your doctor and work with your doctor. One doctor told us years ago, drugs are to help you, but you have to really be in the driver's seat too sometimes and figure out which combinations work and which dosage, and don't give up easily. And keep trying, and eventually you'll find some regimen that works for you.
Hey, Steve, I'd like to know what the average dosage for gabapentin is.
I don't know. Glenn, do you want to answer that? 300, 600 milligram? Or?
Yeah, very much weight dependent, however. They'll usually start you somewhere from 300 to 600, but I've known people who've gone all the way up to 3,600.
Yeah, I've heard 2,000, 2,500. I've heard a lot of doses. I mean, the only negative thing I've heard about it over the years is that it can make you feel kind of dopey, like you're drugged somehow, and you're not as sharp as you were. So I don't know, that it's an individual thing. But whatever works.
Can't you go up?
Yeah, whatever.
Can't you go up? This is Larry or Lawrence. Can't you go up pretty slowly and titrate yourself? And you also have to consider kidney function. Because in people, in late adulthood who have lower kidney function, more of the medication stays in the body longer, although it actually is metabolized pretty quickly, I believe 6 hours.
Yeah, half-life of about 6 to 8 hours.
Yeah, kidneys are one organ you kind of forget about, but it can be very important later on. So again, consult with your doctors. Thank you, Glenn. Okay,
Thank you.
we only have about 15 minutes left, so I'm sorry if you didn't get a chance to say much. Let me now ask Bill Porter to reappear. Let's see, get him on the screen. You're here. Okay, Bill. So could you maybe give us about your 12-minute version of the 16 A's, and then that'll leave a few minutes for questions.
Okay, I'll do that, sir.
Go ahead, Bill. The floor is yours.
My name is Bill Porter. I'm from Richmond, Virginia. I've had peripheral neuropathy since 2005. I'm a member of 4 different support groups, but my home group is the good old Virginia DC group. Thank you to Judd and Pat. And what I'd like to say is I'm going to skip around and pick about, half these A's, okay? But over my 15 years of having this nice disease, so to speak, as some people call it, it's an orphan disease. It's a secondary disease. No, it's a condition, and no, it's a symptom. So whatever you have, you've got it. And the first thing I want to say is the best way to find out if you have it or don't have it is to find a neurologist or a neuromuscular neurologist, which I find to be the best. I started out with, it was idiopathic, and then it went pre-diabetes, and then it went idiopathic, and then it went back to diabetes. So going through the process is a long journey, and we're here to give you hope and support. But I would like to talk, first thing as I said, during my years of having neuropathy, I've come up with what I've called the 16 A's, but I'm just going to highlight most of them, or some of them. One is being your own advocate. That means that whatever the doctor says, you have to go out and you have to ask the questions, and you have to ask the doctor what's going on. And if they don't, if they say, well, we can't help you, you've got to go out and find the right doctor. You have to be your own advocate. Also, attitude. You have to have a very, wake up with a positive attitude. It's I call the neuropathy is like a meandering stream. It's a winding road of frustrations. But if you wake up and you feel bad and you feel lousy, you've got to find a way to get out of bed and be positive. Another A is associations. And I find it very important to be with a support group or some network or foundations or family and friends, but you need support. And it's been brought up during this discussion about the peripheral neuropathy support groups before and the foundation, but you need to be a member of some association. And if you can't, be with friends, be with family to help you through. Also, another A is accreditations. I've heard people talk about certain doctors they went to, but make sure you check their degrees and their specialties. And your first line of doctors is probably your primary care, your podiatrist, an endocrinologist, a chiropractor, a counselor, a psychiatrist, but start with your primary care and try and get to a neurologist. I find them to be the best hope so far. Another A is accounting. And what I mean by accounting is sometimes we have flare-ups during the neuropathy, everything's fine. If you keep a diary of what's going on, what you eat, what the weather is, this will give you a good idea about flare-ups of what I shouldn't eat, or whether it's cold weather, warm weather. Different people have different flare-ups. So keep a diary. It's very important. My next day is accounting.
You said accounting.
Oh, excuse me, accounting. I'm skipping. My next one is apothecary, meaning I'm talking about drugs. Most drugs given for neuropathy is off-label, meaning there's really no drug strictly for neuropathy. There are some companies that are working on them right now. One is Wincentor and the other is Avatars, I think, are working on some drugs, but they're in the they're going through phases. I've been through 3 or 4 trials. I'm 76 years old, and now I found out that I'm too old to apply for a trial. So anyway,
we had somebody speak from we had someone speak to us from Wincentor, and if I'm not mistaken, aren't they trying to reach the idiopathic community ultimately, or am I wrong about
diabetic?
Only diabetic.
You probably spoke to Stanley
diabetic,
Kim.
right?
Stanley
The one who's looking at idiopathic is Dr. Gordon Smith at Virginia Commonwealth University. He's doing studies, but I haven't heard of anything further from him.
Well, I applied for his trial and I was turned down because his age limit was 75. So
okay,
there are plenty of, as Glenn will probably tell you, there are tons of trials going on, and
right.
What do you go to? Glenn, help me out. Do you go to PBX Med for trials or?
Yeah, I mean, you can also go into the NIH and actually pull up neuropathy or nerve trials and take a look there as well.
Clinicaltrials.gov.
Yeah.
And start there.
Okay, go ahead, Bill.
Also on apothecary, be careful of generic drugs and generic fillers, time release versus brand. And also, I found out the best person you could talk to when you're prescribed a drug is your pharmacist. Talk to your pharmacist. Okay, my next one is accessories and accommodations. For an example, some people go to a podorthist, which is specializes in shoes and lifts. Some go to an orthotist, which specializes in, a foot sample. There are socks and gloves. There's electrotherapy. There are aids. There are walking sticks. There are machines. There are light and laser therapies. There's a rebuilder. There's lumbar. There are so many different devices and accessories. Some people swear by a certain one, but my advice is to try, first off, check it out, and then don't pay a big exorbitant price. Watch out for TV ads that say, come in here and we'll see if you have neuropathy. You could get a free screening and you'll find out that, well, if you pay $5,000, you could go through this treatment. Just be aware of who you talk to, and these
there's a lot of newspaper ads like that too. We were getting deluge with them from a couple of places in Virginia, and I remember I called one to maybe speak to our group. This is 5-6 years ago, and I asked for like a resume or just a bio description of the director, and they never sent me anything. So that was sort of a sign that not to follow up. And a lot of those were really scams, I think. When they advertise, especially, cure your neuropathy, come to us. Anyway, be really careful of stuff like that.
Very careful. And also another one is awareness. For an example, on foot care. For an example, I wear white socks because I can find out if my feet I experience tingling, numbness. I've been through all these sensations. White socks I find to be very good because they can, if I see a little red spot, I know something's going on. I also extra wide toe box, and I'm curious, do certain, like I say, I should say it's more, if I have more time, sort of an interactive. Does anyone have a certain type of foot care or sock that they use that they found successful?
Pat, can I ask a question? Is there a recording of your last session with the Virginia group? Didn't you have a presenter talking about foot issues and shoes and socks?
Yes, we did. And that is available on our website. It was initially a presentation by Joe Ponzi to the Pittsburgh support group. And we recorded it and asked his permission to re-show it. And we got a lot of positive feedback. And it will be available. The recording will be available on our website, which I just put up on the chat, dcpnsupport.org. And if you go to the calendar, it will say past events and you'll find the information there.
Excellent, excellent.
Could you please repeat the website a little slower, Pat?
Yes, it's in the chat if you know how to use the chat, but it's dcpnsupport.org. I always think of it as, if you go backwards, org, it's an organization to support peripheral neuropathy in DC.
In DC, right.
Great, thank you.
dcpnsupport.org.
Yeah, Bill, you want to pose your question again? You asked about specific socks or shoes. What was your question?
No, well, I wasn't sure if someone had a certain sock or shoe that they use that could be helpful to the rest of the group.
Well, I find I wear a pair of sneakers and a pair of slippers, and I have one pair of dress shoes, and that's about it. I can't really use a lot of other shoes, and I have an orthotic. I use a lot of white socks, as you say, or thinner socks. I've never found any kind of magic bullet with shoes, but I think there are things you can do, short of getting into, AFO, what are they called? AFOs or braces or all kinds of other devices you can put on your lower feet. So
if you're interested, please listen to the recording, because Joe talked not only about brands, but also particularly diabetic issues like using the white socks. If there's a spot of bleeding, you will notice it on a white sock and you might not notice it on a black sock.
Right.
And it just helps you to be aware of the importance of foot care, especially if it's diabetic neuropathy. And
right.
He also talks about assistive devices, which he is able to fit.
Is he in Pittsburgh area, or is he locally here?
No, he's in the Pittsburgh area.
He's in Pittsburgh, okay. Because there's also a guy named Joe Treppenning at Infinite Technologies, who's in Fairfax, who has spoken to us 2 or 3 times. Is he comparable to this Joe in Pittsburgh, Joe Treppenning?
I think so, but the guy in Pittsburgh, Joe, was just so down to earth and so practical minded. I don't have diabetic neuropathy, and I learned a lot that I didn't even realize. So
no, I definitely want to check that myself. But we only have a couple of minutes. You want to give us your last A, and then we'll see if there's any other questions?
No, I'm going to just say one thing. It won't be an A, but I wanted to tell you that many people just throw up their hands and say, nothing can help me. And I just want to say that two things that can always help you is, one thing, we have hope that there's going to be a cure or help for neuropathy. And also we have support from the support groups. So please remember, if you throw up your hands, I can't take it anymore, just remember you have hope and support.
Excellent. Well, thank you for that. Does anyone have any questions for Bill?
Hey, Bill Hurley.
Go ahead, Bill.
Mr. Bill, I want to thank you for one thing. The most important thing you said tonight is attitude, because I honestly feel, and I've been in sales and marketing all my life, and I'm a manager of training and everything else. When a salesperson says to me, I can't do it, it's time for him to hit the road. And when somebody, a doctor or anybody else, tells you there's nothing that can be done, time to put that person out to pasture, because positive attitude is the most important thing. And I thank you for that.
Absolutely.
Thank you. Thank you. And then ultimately, I think, Bill, your first A in your list was acceptance. And I remember I made a comment to you that I would put acceptance maybe at the end of the list, because basically you go through everything and then you have to live with yourself and you have to live. And so you accept what the situation is and you do the best you can with your acceptance. So Anyway, I want to thank you very much for that, Bill. And we can, do you have something written up that if anyone wants to get a copy of it, can we email it to them or?
Sure, for $10.50.
Okay. Per page.
I will send you a copy.
Per page or what? Okay.
Per page.
Per page. Okay. Well, just
the
send
Virginia DC group is asking Bill to write it up, polish it, and make it beautiful. And we're posting it on the website for everyone.
Okay, excellent. Okay.
Once he's comfortable.
Great. Well, it's exactly almost 8 o'clock. So I want to thank everybody. I want to thank Glenn, who I wasn't expecting on, who always has a lot of expertise. And he, by the way, is very active with the Western Neuropathy Association. And there are many other support groups. The way that I got Bill tonight to come was ironic. I heard about this woman in, I think, Washington State, who runs a very good support group. And one Saturday, I think I joined it, and Bill was on the call. And then he's in several groups, as he says. And so I invited him for tonight. So there's a lot of information out there. And bottom line is, you're not alone. If it still seems overwhelming, start small, go to Newly Diagnosed. If you have any questions, send me an email. My email is my name at gmail.com, steve.klitzman@gmail.com. And I'll respond. I try to respond the same day if I can to most of the emails I get for the next day.
I just put it in the chat.
Great, thank you. And then our next meeting will be October 20th with Dr. McCrae. Well, good luck, Charlotte, who's meeting with him on Monday. He's a good man, and we'll hear what he has to say. So have a good month. Get in touch meanwhile. And if I see anything, if I have your email, I periodically will send out articles, information, studies, testing, whatever, because just doing this once a month is great. But frankly, you're living with this every day. And once a month is probably not enough. You really could benefit from more stuff.
Steve, could I add one quick thing?
Go ahead, Pat.
The Virginia DC group has begun, or I've begun something called Footnotes. And I try once a month when we send out our invitation to our meetings to update people on events and webinars. So I wanted to make sure that people knew that there is an upcoming webinar called Hereditary Neuropathy and Genetic Testing on October 6th at 2 o'clock Eastern Time. And you can register by going to the Foundation for Peripheral Neuropathy.org. And I put that earlier in the chat.
I wonder if Dr. McCrae is in that webinar, because that's his expertise is in that area.
Yes, October 6th at 2 o'clock. You can register now.
Okay.
And,
all right. You know who's on the panel or in the webinar?
No,
Okay. All right. Well, that's good to know. And that'll prep you for interacting with Dr. McCrae on October 20th. So that's great. Thank you for that.
Could I quickly ask a question?
Go ahead. Go ahead.
This is Bonnie, and this is our first visit. What is the website here? Would you put that in the chat? Your group website? I do not have that.
Okay. So we don't have a website for this group. The Virginia chapter website is dcpnsupport.org. DC, all one word, dcpnsupport.org. And they have an excellent website that Pat and Judd maintain. You have that?
Yes,
I got that.
It's in the chat.
Yeah, we frankly didn't want to reinvent the wheel or compete. I don't have the expertise that Pat and Judd have dealing with web.
Okay, but October 20th is your next.
October 20th, third Thursday, always the third Thursday of the month at 7 p.m. October 20th, Dr. Brett McCrae. And you'll now that you've registered tonight, Lainey at the hospital at Suburban, you'll automatically receive an email from her, and all you have to do is click on. She sends out the link to the Zoom session, so you don't really have to do very much if you've registered tonight.
So I got today.
And that's how you got to read. Yeah.
Okay. Very good. Thank you. Have a good evening.
Thank you, everybody. Bert and everyone else who knew, and David.
Thank you.
Quick question, Steve.
Be well. Thank you. Bye. Take care.